Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson. I have Dr. Sara Swift here with me, and we're having way too much fun with this. So this week we want to do true or false pregnancy edition. Our first question. Heartburn. Will my baby have hair?
So here's the lowdown on that. So there's actually a study that came out that showed that 26% of women who had moderate to severe heartburn their babies had significantly more hair than average. So I guess you have a quarter of a chance of having a baby with a lot of hair. So that's going to be kind of like a false.
I like to think of it as more, I'm 5'2", and my esophagus is shortened, therefore the acid comes up much quicker. I am very prone to heartburn. Both my children have Rapunzel hair. But I have a lot of hair too, so...
I have none. My children were bald till like 3.
Okay, so that's okay. First trimester question. Well, really any trimester, but I hear it a lot in the first trimester. Can you dye your hair while pregnant?
You can dye your hair, buddy.
Can you get a perm? I mean, does
Wanna
anybody
get a
do
perm?
perms? But like, like the bleaching, the smell.
It should be fine. The majority of places are well ventilated. Obviously, if you want to play ultrasafe, you can wait the first trimester. But, if your roots are showing and you want to go and get it, highlights especially because they don't touch your scalp, fine to do, but go get it.
Okay.
So there you go.
There you go. Can I have a glass of wine while pregnant?
So that's a no.
I hear more like, I can have a glass of red wine, not white.
So the color doesn't matter. Nobody cares. Like, I don't know why we make ourselves better, but it's red, so it's cool. So there is no safe limit in pregnancy, so we're going to have to say that is a no. About 10% of babies are actually born with a spectrum fetal alcohol syndrome, so that would be a no-go. Now, while you're breastfeeding and pumping, that is a different thing. That would be a yes. But while you're pregnant, then no.
And you don't have to buy the little test strips that test your milk. Don't have to pump and dump. How you feel is how your milk feels. Wait it out. You're good.
Just don't drop your baby.
Don't drop the baby.
No.
It's always good just like pump before you have a couple drinks. And then by the time baby's ready to eat again, those drinks have metabolized and you're good to go. Okay, cool. Oh, this one hurts a lot of women. I can't eat soft cheeses while pregnant.
So that's false.
What?
Actually.
Eat the soft cheese?
So as long as your cheeses are pasteurized.
Okay.
That is the only thing that we care about. The bacteria that we worry about is Listeria.
Mm-hmm.
It's really hard to find a non-pasteurized cheese in the U.S. So pasteurization, whether it's milk, juices, cheeses, then it's fine.
Okay.
So no milk from the teat.
Ooh, this is one. I can't eat sushi while pregnant. So many women. This is a hard one for them.
So if you've seen me as a patient, you may have heard me say if sushi killed babies, there'd be nobody in Japan. So the thing that we worry about sushi, they're sort of twofold. So one is going to be mercury. So we avoid that stay away from shark, tilefish, some of the bigger feeder fish. So that salmon, those things are fine. Obviously everything in moderation. And then we worry about food contamination. So there's always a chance of getting a foodborne illness from uncooked food, but there's lots of things on the sushi menu that are either
tempura and
cooked or smoked or things like that. So go have your sushi.
What about lake perch?
So depends what kind of lakes, but usually should be fine.
Okay. Because some people ask. I mean, we're starting the whole Lent season here.
Right.
Friday night fish fries are on.
Go for it.
Eat your fish fries.
Eat your fish.
Okay. What about the whole true or false? I'm eating for 2.
So as much as I wished this was going to be a true, it's actually a false. So your caloric requirements for your first trimester are 0. Okay. No extra calories. Second trimester, about 200 calories. So that's going to be like a yogurt. Yeah. And third trimester, about 300 some calories. So like half a sandwich.
Okay, so really, don't have to carb load it.
I mean, unless you want to, but there's no need for it.
That's
so,
fair.
if you're not feeling fine, you're nauseated, don't worry about it. Eat what you're able to. Your baby is a perfect parasite, and it will be just fine.
Absolutely.
I just called babies parasites. You're welcome.
Perfect parasite. At least you it's kind of true. They do. I get you.
It's a good design.
If anyone knows you, they get you. Like, yep.
Yep.
Yep, okay. Ooh, this one, I don't know. True or false? Higher the heart rate means a baby girl. Lower heart rate means a boy.
So it's false.
What?
Yeah, I know.
I mean, I feel like that's...
So you got a 50-50 shot of having one or the other, right?
Right.
So if you have like 3 girls at home, you have about like a 95-98% chance of having another girl. Sorry, same thing happens with boys. Aside from ultrasound, although ultrasound can be wrong too, there's really no way of figuring out aside from cell-free DNA or delivery. Delivery is a really good time to find out what you're having.
Sure.
It's really sort of accurate to find out the sex of your baby.
We can't play the Drano game? Is that in here?
No, I didn't put. We didn't put the Drano game in there.
We'll play like how to have fun. These are fun things like using Drano to decide if you're having a boy or a girl. I don't remember how you do it, but
I don't know. Google it.
you like put your urine in the Drano and it turns a certain color.
What?
If it's green, it's a girl. I don't remember.
Anything.
Somebody tell me what it is.
Anything that requires you to play with your own excrements, probably not a good way to find out what
You're
you're
no
having.
fun. Okay. All right, so that's false. Okay,
False.
well, all right. Oh, I'm craving lunch meat during my first trimester, especially.
Mm-hmm.
Can I have lunch meat while pregnant?
So, it's all about risk, right? Mm-hmm. So the big thing that we worry about with lunch meat is, once again, bacteria called Listeria.
Yep.
Now, we haven't had any outbreaks. Your chance of getting Listeria is probably higher with cantaloupe and...
Salad. Lately, like every Christmas.
Cantaloupe in the summer, lettuce around Christmas. Oreos have never had Listeria, though, so apparently Oreos are safer.
And they're vegan.
They are, for those that gave up meat for Lent.
You now have Oreos.
Yeah, I can have Oreos. So the risks are low. However, there's a hypothetical risk. So it depends on how much of a risk taker you are, and obviously listen to your doctor. But if you want it to be ultra safe and you're really craving it, you can nuke it and then refrigerate it. Sounds sort of unappetizing to me. Yeah. And so this one's going to be kind of in the maybe bucket.
What about those who like want a big old steak? Some err more on the side of like well done.
Well done if you're gonna play safe.
Okay.
Yeah. Don't. If it makes noise on the plate, it's not well done.
That's fair.
If it bleeds, not well done.
Okay. Perfect. All right. Oh. That you can't take a bath while pregnant.
Oh, that's false. Get in the tub. Get comfortable. So you can fill up the tub with warm water. The tub never gets super hot, and it's not going to be enough to raise your core temperature. Obviously, if you're lightheaded, you don't feel well, put some cold water in or get out of the tub. Don't fall over. The big thing we worry about is mainly hot tubs, which can raise your core temperature.
And there's bacteria in hot tubs.
That's a whole separate talk. That's a different Tuesday talk.
Right.
But you can get it in the tub. The tub is a great way of pain relief. Late pregnancy, even early mid-labor, just because water hits all these pain receptors and kind of distracts you from discomfort.
Yeah, and bacteria is not being introduced. Like, that's what a mucus plug is for. That's your body naturally pushes out things.
That's
so
what
you
your
don't have to
lady
worry.
design is for. So, fine to get in the tub. Go get it.
Okay. Walking to induce your labor. I mean, we could do a whole Tuesday talks on what works and what doesn't work to induce labor.
Maybe we do that.
But we're going to have to do that.
It's
false.
It gives you something to do.
And it can bring on contractions, but it's
can.
not going to put you in a pattern of labor.
No. And so obviously, you go out
Don't
there.
exhaust yourself.
Go to Target, but like if you walk like 5 miles, you got your steps in, you close your rings and your watch.
Perfect.
That's about it.
Ooh, this one's a big one. Stretch mark creams help prevent stretch marks, or like just lathering yourself in vitamin E oil.
So this one's false.
It's totally false.
So we've made a really great business of selling these stretch mark creams to pregnant women, which are super expensive, and everybody's like, oh, I got no stretch marks. So if you don't get stretch marks, thank your parents.
Yep. I was gonna say
Genetics. Stretch marks are the hereditary. If you have a big baby or you have a lot of amniotic fluid and your skin gets stretched more, you're higher risk of getting them. But no amount of cream or rubbing or anything of that sort will make a difference.
And they will fade.
They will fade.
I mean, they'll be there, but they'll fade. You won't really see them.
Yeah, the biggest thing that you can do in the first year after getting stretch marks is sunscreen, just because they are brand new scars, essentially. So anytime you get a cut or anything, we recommend shielding them from the sun for the first year. And same thing with stretch marks.
Good to know. All right, we have 2 left. Another one to induce labor, the spicy food. Like the eggplant parmesan down south where you have to be at least 39 weeks and sign a waiver. True story.
That sounds like heartburn waiting
Road
to
trip.
happen. Yeah, road trip. Yep, we got some time. So that's a false. So everybody has their anecdotal story what put them in labor.
Absolutely.
You're just gonna be refluxing all night. So if you really love spicy food, go for it. But otherwise, just skip it.
Okay. And last one, no caffeine during pregnancy.
So that's false, actually. So caffeine in moderation. The studies are not great, but we know that up to 200 milligrams is safe. The studies
That's like a lot of coffee. 200 milligrams?
It's a respectable amount. And actually, third trimester caffeine use, babies exposed in utero to caffeine actually have less of a reaction to it in breast milk. So if you're going to pick up a cup of coffee when you start breastfeeding, not a bad idea to maybe get them used to it. I don't know. But if you're craving coffee, if it's part of your routine, go for it. It's not going to harm your baby. 200 milligrams is what we usually recommend sticking under. So it's a decent amount of coffee.
Perfect. Well, that's our true or false edition. We're going to have a lot more editions of these, so we have a lot more to talk about. All right, guys, we'll see you later. Have a good one. See you next week.